Now we'd like to invite Mr. Hamsavardhan Mohan, Managing Director, Bharuch Business Solutions, to lend us insights into the topic of becoming industry leader in healthcare, IT, and future plans. It's over to you.
Thank you, Dr. Vanita, for giving me this opportunity, for recognizing us. Secondly, I would like to thank the leaders, speakers. First of all, we had a nice talk about, we heard about a nice talking from former director of IIT, Dr. Ram Gopal Rao. It was so inspiring about how to bring people to the business sector. The IIT had made a great difference in bringing most of the business people we know, starting from Google, from here. Most of our Indians were from IIT, who were in US, across the country, who leads the top businesses in the world. I can see that when all the questions that I had, I think she had questioned and had answers for those, just like how to make the same kind of inspiration to other institutions, just like IIT. IIT had such a kind of having a faculty, greater faculties, working for them and working for other companies who can give more insights to the students. At the same time, they can work for the other companies. Just like them, why can't 90% of our private sector institutions didn't have that kind of exposures for their students, which is more important, which is what I like to hear from him, which is that exact question that you raised, and we really I was so happy about hearing those from Dr. Ram Gopal Rao. Secondly, we talked, Mohit ji had talked about the finance, which is so important. I have grown from a media family, and starting a business is not so easy as we have all come across. Thirdly, Saxena ji had talked about the B2B sales. I see all the key factor of how the SaaS functions and the sales that has to execute it well enough for any product to grow or to execute or to at least see a progress for a product. I really was wondering how these can be imported into an organization structure. So I really inspired about those, Dr. Saxena ji. Thirdly, we heard from Neeraj ji. We were so inspired about your talk and your way of how you have grown. All of you have done, and how you have have a gut to sell it out to a company which is well known, and sharing space with you all is so inspiring and so grateful. And I'm having the gratefulness in me, and having the gratitude for Dr. Vanita Agarwal for sharing the space with me. A little bit about Bharuch Business Solutions, about myself and Bharuch Business Solutions. I'm from a mediocre family. I didn't have a greater exposure towards businesses. For an instance, Dr. Ram Gopal have said about if an IIT candidate can do it in 10 seconds, the other institution people can do it in 20 seconds. And I'm not even to the 20 seconds. I'm from like a tier 2 city from down south from Tamil Nadu. You must have heard about the famous temple, Brihadishwara temple. That is where I am from. It is a tier 2 city. It is surrounded by villages. So I have started the company called Bharuch Business Solutions after 10 years being into this industry in 2016. everybody were asking, why can't you start a company in Chennai, Delhi, or Bangalore? You had so much exposure, so much resources out there. But I thought it is good to start where you have a face value, where you do not need greater investments. Um, while during that point of time, after 10 years of being into the healthcare IT industry, it is so hard to find out or to get into a business. To me, starting a business is kind of an accident. Working for so many companies in that 10 years, for the last 2 years of my career with other organizations, people started asking, why can't you start a business? Because I had an exposure working with multiple departments in the same industry, the healthcare IT industry, which is serving across the US. We're currently serving across the US for about 21 states. So when I left the company, people, being a consultant, people started asking, why can't you do service for us, just for us? Then I started as a consultant. And that is when, people flowing into my bucket as, why can't you serve we, as other company as well? So that's when, in 2016, from consultant to become an entrepreneur, and then from being one consultant and adding up more people to the organization, I've grown up to 200 people right now, 200 plus right now. So a little bit about the services is healthcare IT sector is not that exposed in India, but in other countries like Europe, Southeast Asia, Australia, US, UK, they have this healthcare IT which has a correlation, which has a interrelationship between the doctors, patients, and insurance company. So in India, it is emerging. We pay cash, as Neeraj ji said. Our economy is cash flow 90%, but over there it's all about through insurances. And other countries all about insurances. So we have to be mediators between insurances, patients, and providers. So we become a back office for providers, medium-sized, small-scale, large-scale hospitals. So we are the person sitting in the backward to get their reimbursement done on a timely fashion. So we have about 15 departments who work for them to guide them on how to get into a software, to create a software, to create an account for them. I'm not having a background of a software, but I work for multiple softwares which is being utilized by the providers and the hospitals, which does require to document their treatments. So in India, I can see there are emerging, fresh graduates of doctors. They are started utilizing softwares to document their treatment level. So which is going to help us in a great run on how these, how many what all specialties. If you look at the other countries, the specialties are way high. When compared to here, the specialties are less. They're not pointing out one single specialty, but here we look at it in general. If you go to a podiat or a foot clinic, there is no specific foot clinic here. There is orthopedic. But in other countries, they go in detail to learn more about or to get treated for a particular services. So here, when they look after those softwares to start utilizing those softwares, they were able to gain more knowledge about treatments on how these can be documented on a timely fashion and reported and can be looked after for any future references. So those kind of things are emerging right now in India. But over there in other countries, for us, it is all about US. We are serving US currently. So we can get into their software so we can see how these things can be manipulated, starting from electronic health record and the billing side of it. There are two sections for this healthcare IT. There are two sections. It's one, we call it as electronic health record. The other one is practice management, wherein In EHR, doctors used to do their charting about their treatments. On the other side, it's about how to get these coded. You know, for instance, for an example, if it is just a consultation, it cannot go to a insurance company to get collected as straight away. For a consultation, you can charge $100 or something. We cannot do that here. But over there, there is a international coding guideline. Everywhere is, we can see ICD. It is across the globe, but we're not utilizing it full swing. But we have a separate coding team. There is a separate coding institutions here, which is across the country. So through those coding, we can get those treatments converted to the coding and get them billed to the insurance companies. Between these providers, softwares, and to the insurance companies, there's a clearinghouse in between to translate these in electronic format. As in, there are several other formats that has to be communicating between the insurance companies and the providers to have the reimbursement done on a timely fashion. So which is what the healthcare IT was actually doing in US, and which is what we are doing. So we've been, being in that industry for 10 years, it took me about 5 years being in that and to develop that company to about 200 people right now. All of the speakers here talks about the products and the sales and services. What my presentation is more about what I have done on the healthcare IT, because what I see is majority of the software company in India either deal with developing a software for insurance companies or developing a software for doctors' offices. 50% of the businesses here, if you take the top notches like TCS or CTS, they develop softwares. On the other side, they do utilize the applications for the providers to communicate back and forth. And they have the services, they have the back-end support services to do all these kind of workouts. So what I have a presentation is just what I do and how we grown. And without, we don't, as we talked about the investments and angel investors, there are so many investments that requires to do a business. For me, when I started being a consultant to an entrepreneur, I did not really needed greater investments by then, because it's just me. What I thought, my only thought I had is if I have to start a company, I have to have a workspace. So a shared workspace is what I wanted to start a company for. So then I have given out some of the projects to external people who can help me build the business. I have hired a website developer. So we three have jointly started a workspace. It's just 1,200 square feet. When I started in 2016, it just had 3 workplaces. About in a year or two, we became 35. For becoming a 35, we become dominant, and then the other people wish to, it's okay, you can take care of that spot. We can take away from that spot. They allowed us to grow, which is grateful for me, and I'm always grateful for those people who let us grow. After 2 years of time period, whoever the clients were, whoever the being as a partners were, they came, visited our city, which is a tier 2 city. They liked our environment, they liked the resources, because the most important aspect of a business is resource, people, human resources. So without the human resources, we wouldn't be able to achieve 200 plus people right now. I'm not a straight business mentality because I don't have a background of management. I came from the experience. I had gathered experience. I gathered working with multiple departments. So that gave me an exposure to start a business. So they came after 2 years and they see a greater talent in us, and they wanted to buy out a business. I said, no, that's not how we work, because we started with all the talents, all the knowledge that we had. So I don't want to sell out the business. I can be a partner. We can be a collaborative business to work together to get more clients. So then they liked it, and they started, sourcing more projects for us. And I don't do much on the business development, but this is how it grown to 200 plus right now. And people right now are looking at us, and they, we are recognized by Silicon India magazine for consecutive three years since 2019 to till now as a top 10 company, medical billing company in India. If you also look at Quora, I have seen somewhere before a year time, Quora also has us listed the top 10 companies in India for healthcare IT industry. So I have something to show as well. So this is just a gist about how we started and what year and how well we have grown to this extent. These are all the 3 locations that we had. We have a head office. I made it as a head office as Tanjavur, which is a tier 2 city. I made the Coimbatore office as a branch office, and we have a corporate office in Reno, Nevada. We recently started that because people started asking us on how we can get to more projects being in India. We wanted to have some set of people working in US. So after 5 years, we had set up an office in US, and these are all the 3 locations that we have. Our goal is to serve the industry, healthcare industry across the US to every locations. Currently, we're serving 21 locations in the US. This is our hierarchy structure that we have for all the 15 departments we handle. It's about the services, what all services that we do. So I don't know how many people have heard about this term, medical billing or coding. These are all the services that includes medical billing, accounts payable, denial management, accounts receivable, medical coding, transcription. If I said the word transcription, you must have heard about 20 years back, people work from home. You must have heard about it before, 2000, people working from home. That is when internet is booming. That is when we got to know there is something, people working from home and making some money. How are they doing that? So this is the beginning. Even before the software industry got boomed in India, transcription was the first one. Now it is no more, it is fading out. But we still do the service just because there are still doctors, hospitals, they still need the transcription services. We have people working across the country. There are people who works from office, plus 10% of people work across the states as well. There are some from West Bengal, from Calcutta, from Chennai, from Kerala. There are people working from because their industry have gone. They worked for 15 to 20 years, and their industry is faded away. Now we are able to employ through that kind of service, and we have utilization management, which is helping them to understand whether these services can be done or neglected based on the insurance policies. So we have credentialing. Credentialing is something, the best piece that I would say as a service, because I don't know if I go detail, you would not be able to understand, but if you go deep, if I have to tell you about credentialing, only the very few Indian company, I can say CTS, Cognizant, and HCL does the credentialing services for them, because this is something very new to the doctors. Doctors really need credentialing to be done to service in US. They cannot do service just right after they graduated, and they cannot do the service in US. They have to get credentialed. So this piece of service does help new grads to know about us. There is somebody in India, they know about how this can be done for even a startup. Even after some experienced doctors, they wanted to start up a company. They want to start a medical practice, but they don't know how these contracting can be done. So we have this expertise to get these done for them to start a practice, and which can help thousands and thousands of patients. And another part of his transition implementation, which is usual, we have these many services that helps the US healthcare IT sector, and these are all the things that I would like to mention, and that's something that how we have grown. This is just exaggerating us on how we grow, but just an example on how what all sides that we have worked on and how we've grown from 2016 to 2022. Right now it's 200 plus. We're expecting to grow hundreds and thousands of people in the next few years. And those are all the highlighted states that we currently serve. And the unique features that I just explained through the services. Credentialing is one piece of that. There are several other IT that Dr. Ram Gopal Ji had said about the data. The data is a major aspect of any businesses. So there needs to be a security, the IT security that we have to keep in the compliances. There are some other compliances related to healthcare as well. So there are two aspects. One is IT data security, and the other one is the compliances for whatever business that you do. There are some compliances that we need to look at, which is also going to give us, give the customers or clients to have more confidence on us on how we deal with the data. And about the specialties. There are 30 plus specialties that we expertise in, and there are about 2 decades of experience of people working with us, more than my experience. I even had 15 plus, and people working for us is having 2+ decades of experience working with us. Those are all the features and service that we currently have, and how we have grown as a team. As you can see from my talk, and I did not mention more of the management terms, more of how we have worked through this way is about the collaborative work. We have to make sure that we are having a greater communication between the team members. Even from the trainees till the VPs, we should have a greater communication. There are so many channels these days, so many communication channels, not just emails. Apart from that, there are so many chat communications, Slack, so many other communication channels that we should have our collaborative work. And the quality, we should never be, letting down the quality. You always keep up the quality as the first place, and confidentiality about what all services that we do and how we do between other clients, and we need to keep up that confidentiality. And accountability, this includes we as a reimbursement company, and from the financial side, accountability is more important. Every day we need to watch out, because most of us will look for what's coming in and what's going out. We need to look at both sides. As we previously had a session about that too, and about meeting the client's expectation is more important than anything. So we're not going to let any of this topic go down to keep up our business running in a better fashion. And this is our goal, to keep our footprints in every state across the US. And how does it help for India? Is right now we are in a very beginning stage of utilizing the softwares, just like hospitals. They have the better system on charting their treatment protocols, and we could be a greater help on implementing those softwares in medium-sized medical practices as the next stage. Because if you look at across the world, Africa has it. Indians having less exposure towards the software, but we began utilizing the softwares in hospitals, but our goal is to utilize from every single small clinic who emerge starting their clinics. They should start utilizing the softwares. For them, they're much needed right now. These days, they're much needed about the softwares. We are there to help them implement those softwares in their medical practices, and then have their protocols or have their treatment protocols charted accordingly. They go based on objectives, assessments on plans or each patient. These days, we only talk to them, but they also like to document them for future references. So we can help them in a timely fashion of how we can have our Indian doctors to keep those softwares up and running in their clinics. So this is how, this is what we have. I thank you so much for hearing me out today. Let me know if you have any questions.
There's a question.
Hi, Mohan. Thanks for your presentation. I have a question. Since you have been doing this IT for US healthcare, everything is data sharing. In US, you have like bigger hospitals use this software like Cerner or Epic. How do you get the data from those big chain systems?
Epic can be whitelisted for IPs, which can be utilized through our dedicated local IPs. We have our static IPs, which can be accessed, which can be given access through their system.
Let me tell
We
you.
can utilize their remote desktops.
Uh-huh.
So there are so many softwares. As you know, Epic,
Does the permit?
Zermed,
Does the
Theos.
permit?
Theos is all DOS-based version. So we still can access that through a remote desktop.
Without they knowing, right?
They have to whitelist our IP.
Are they doing it?
Sorry?
Are they accepting it?
Yeah, they can. If they wanted to come down on the costs for the resource utilization, they can do that.
Good.